You have been taking your blood pressure medication every single day. You have not missed a dose in months. Your doctor says your numbers look fine, and yet something still feels off. Maybe you wake up with a headache. Maybe you feel dizzy when you stand up too fast. Maybe you had a reading last week that scared you even though you took your pill that morning. Here is what nobody has told you yet. Taking your medication is only half of the equation. When you take it, what you take it with, and the simple daily habits you pair it with, can either double its protection or quietly cancel it out. And most people on blood pressure medication for years are making at least one of these mistakes right now without knowing it. There are 5 specific mistakes that people on blood pressure medication make on a daily basis. Some of them are hiding inside routines that feel completely harmless. One of them is so counterintuitive that when most people hear it, their first reaction is disbelief. But the research behind it is some of the strongest evidence in cardiovascular medicine right now. We are going to go through all 5 today, explain exactly what is happening in your body, and give you clear, practical steps you can take before your next dose. Before we get into it, leave a comment below telling me your age and whether you take your blood pressure medication in the morning or at night. You might be surprised how many people have never even been given a choice. What you share here genuinely helps everyone watching, so take a second and leave that comment now. To understand why these mistakes matter so much, you first need to understand something about how blood pressure actually behaves inside your body across a 24-hour period. Most people picture blood pressure as a steady number, the same at 2 in the afternoon as it is at 2 in the morning. That is not how it works at all. Blood pressure follows a very precise daily rhythm. During sleep in healthy adults, it naturally drops by 10 to 20%. This drop is so important to cardiovascular health that researchers have given it a name. They call it nocturnal dipping. Then, in the early morning hours, typically somewhere between 4 and 10 in the morning, blood pressure surges sharply. The body releases cortisol, the sympathetic nervous system activates, the heart starts beating faster, and the arteries tighten in preparation for the physical demands of the day. This morning surge is not a minor fluctuation. It is the most dangerous cardiovascular window in the entire 24-hour cycle. The majority of heart attacks and strokes that occur within any given day happen during this window. And after the age of 60, when arterial walls have lost a meaningful degree of flexibility, this surge becomes even more forceful and even more difficult for the body to manage on its own. Where your medication sits in its absorption cycle during that window determines a great deal about how protected you actually are. And that brings us directly into the first mistake. Most people who take a morning coffee alongside or just after their blood pressure medication assume they are simply going about their day. If you are on a class of medication called beta blockers, that assumption is costing you. Beta blockers work by reducing the activity of your sympathetic nervous system. They slow the heart rate, reduce the force of each contraction, and gently lower the pressure inside your arteries. Caffeine works in almost the exact opposite direction. It stimulates the nervous system, triggers the release of adrenaline, raises heart rate, and produces a temporary spike in blood pressure. When you take a beta blocker and then drink coffee within the same 30-minute window, your body is receiving 2 powerful and opposing signals at the same time. In most situations, the medication wins that competition, but in people who already have irregular heart rhythms or a history of palpitations, the clash between caffeine stimulation and beta blocker suppression. During the peak absorption window of the coffee can trigger a fluttering sensation in the chest, a racing feeling, or pronounced palpitations that feel alarming. The fix is simple and costs nothing. If you are taking any beta blocker, wait a minimum of 45 minutes after taking your medication before drinking your first cup of coffee. Let the medication absorb and begin working before you introduce caffeine. Always take your pill with a full glass of water because consistent hydration helps medication absorb evenly and reduces the concentration spikes that drive unwanted interactions. Decaffeinated coffee does not carry the same concern and can be enjoyed without spacing. The second mistake involves a food that millions of people consider healthy and start their day with regularly: grapefruit. If you are taking a calcium channel blocker for blood pressure, which includes some of the most commonly prescribed medications in this class, grapefruit is not a harmless breakfast choice. It is a drug interaction waiting to happen. Here is why. Your digestive system has a specific enzyme whose job is to process medications as they move from your gut into your bloodstream. Think of this enzyme as a gatekeeper that controls how much of a drug actually reaches your circulation. Grapefruit contains natural compounds that essentially shut that gatekeeper down, and they do it for a surprisingly long time. A single serving of grapefruit or grapefruit juice can block this enzyme for up to 72 hours afterward. When that gatekeeper is disabled and you take a calcium channel blocker, the drug is no longer processed and regulated the way it is designed to be. Instead of a measured, controlled amount entering your bloodstream, 2, 3, or even more times the intended concentration can accumulate. Your blood pressure does not drop gently the way the medication is designed to make it drop. It falls sharply. For a younger person with flexible arteries, the body can often compensate for a sudden pressure drop. For someone over 60 with stiffer vessels and potentially some degree of reduced vascular tone, that sharp drop can cause severe dizziness, a dangerous fainting episode, or a fall. The rule here is non-negotiable. If you take any calcium channel blocker, avoid grapefruit and grapefruit juice entirely. Replace it with orange juice, apple juice, or water. If you are unsure whether your specific medication is affected, ask your pharmacist directly. It is one of the most important questions you can ask, and the answer takes less than a minute to get. As a practical addition, foods rich in magnesium such as spinach, almonds, and pumpkin seeds support healthy vascular tone naturally and do not interfere with calcium channel blocker medications. The third mistake is one of the most preventable causes of serious injury in adults over 70, and it hides inside something that looks completely innocent. It looks like waking up to use the bathroom at night. It looks like a sleep problem. It is actually a medication timing issue with consequences that can be life-changing. Diuretics, commonly called water pills, are a standard part of blood pressure treatment for millions of people. They work by prompting the kidneys to remove excess fluid from the body, which reduces blood volume and lowers the pressure inside your arteries. They are effective and widely prescribed. The problem arises when someone takes their diuretic in the late afternoon or evening, either because they forgot their morning dose, because they were never given clear timing instructions, or simply out of habit. When that happens, the medication reaches its peak effect in the middle of the night. The kidneys begin working, the bladder fills, and the person wakes up at 1, 2, or 3 in the morning, needing to get out of bed in the dark. Here is where the danger comes in. When you stand up suddenly during the night, your blood pressure shifts. The body needs a moment to regulate the change in position. In adults over 70, this adjustment is slower and less reliable due to a condition called orthostatic hypotension, where blood pressure drops briefly upon standing. When that drop happens in a dark room in the middle of the night, the result is often a fall. And falls in this age group are not minor events. Hip fractures in adults over 70 carry a mortality rate that shocks most people when they hear it for the first time. A significant percentage of people who fracture a hip after 70 do not survive the following year. That statistic puts an entirely different weight on something as seemingly small as the time of day you take your water pill. The timing rule is clear and important. If you take a diuretic, take it before 10 in the morning. If you are prescribed 2 doses per day, the second one should be taken no later than 2 in the afternoon. This ensures the medication does its work during your waking hours and allows your kidneys to settle before sleep. If you are currently taking a diuretic in the evening and waking up repeatedly at night, talk to your doctor about moving the dose to morning. The change can make a noticeable difference within days, because diuretics can also deplete potassium over time, including foods like bananas, plain yogurt, or sweet potatoes in your daily routine, supports healthy potassium levels and heart rhythm. The fourth mistake is one that almost everyone has made at least once, and most people treat as harmless. You forget your morning dose. You remember at 2 in the afternoon, or at dinner, or right before bed, and the thought arrives almost automatically. I will just take 2 tonight to catch up. For certain medications in certain situations, that logic seems reasonable. For blood pressure medications, particularly calcium channel blockers and long-acting ARBs, it can be genuinely dangerous. Here is what happens. These medications work by relaxing the muscular walls of your arteries, which reduces resistance and allows blood to flow with less pressure. A single dose does this gradually with a gentle and controlled effect. Two doses taken together do not simply produce twice the effect slowly. They can trigger a rapid, steep drop in blood pressure that the body struggles to counteract. In younger adults with healthy, flexible arteries, the body often compensates. In older adults with stiffer vessels, reduced cardiac reserve, or any degree of existing heart disease, that sudden pressure drop can cause fainting, and in more serious cases can reduce blood flow to the heart or brain at a critical moment. The second version of this mistake is quieter but equally harmful over time. People prescribed twice-daily medications begin taking them only once because a single daily pill is simply easier to remember. Blood pressure appears partially managed at follow-up appointments. The doctor sees acceptable readings, but the continuous round-the-clock protection the twice-daily schedule was designed to create is operating at half capacity, and the windows of undermedication are where cardiovascular events tend to occur. The protocol for missed doses is specific and matters. If you miss a dose and remember later the same day, take it as soon as you remember, unless your next scheduled dose is less than 4 hours away. If you are close to the next dose time, skip the missed dose entirely and return to your regular schedule. Never take 2 doses at once without first calling your pharmacist, because the right answer depends on the exact medication you are taking. Setting a daily phone alarm paired with a consistent habit anchor, such as your first meal of the day or brushing your teeth in the morning, is one of the most reliable ways to eliminate missed doses over time. Research on medication adherence consistently shows that pairing a pill with an existing daily habit reduces missed doses significantly compared to relying on memory alone. And now we arrive at the fifth mistake, the one that tends to surprise people the most, the one that the research is clearest on, and yet that almost never comes up in a standard prescription conversation. It is about when in the day you take your blood pressure medication. Not which medication, not how much, simply when. For decades, the default instruction on blood pressure prescriptions has been take once daily in the morning. It became the convention because it was easy to remember, it fit neatly into morning routines, and for a long time there was no strong reason to question it. That has changed. What large-scale research has shown is that the timing of blood pressure medication relative to your body's natural daily rhythm matters far more than anyone previously appreciated. Think back to what we discussed earlier about the morning surge. Blood pressure rises sharply in the early morning hours, typically between 4 and 10 in the morning. This is the window when the cardiovascular system is under the most strain and when the risk of a cardiac event is highest. Now consider what a morning dose actually looks like inside your body. You take your pill at 7 or 8 in the morning. It takes 1 to 2 hours to absorb and reach its effective concentration. By the time it is fully working, the morning surge has often already peaked and is already subsiding. Then, by 4 or 5 the following morning, when the next surge is beginning to build, your medication has been declining in concentration for 18 to 20 hours. The window when you need the most protection is precisely when your medication is at its weakest. Bedtime dosing approaches this differently. When medication is taken at bedtime, it is at or near its peak concentration during the early morning hours, providing a pharmaceutical buffer precisely when blood pressure is climbing its sharpest. The arteries face that morning surge with the medication working at full strength, rather than winding down. A large and widely discussed study on this topic tracked thousands of adults with hypertension over several years, dividing participants into morning dosers and bedtime dosers. The bedtime group showed a substantially lower rate of cardiovascular events, including heart attack, stroke, and cardiac death over the follow-up period. The difference was large enough that the researchers described it as clinically significant. It is worth noting that a separate large trial did not find the same level of difference between morning and bedtime dosing, which means the science on this point is still developing and not fully settled. What is settled is that bedtime dosing has not been shown to be harmful for the vast majority of patients. And for people whose blood pressure does not dip normally during sleep, the timing of medication may make a meaningful difference. The most important step you can take based on this information is to ask your doctor one specific question at your next appointment. Should I be taking my blood pressure medication at bedtime rather than in the morning given what the research shows? And follow that with a second question. Would a 24-hour ambulatory blood pressure monitor help us understand my personal pattern? That test records your blood pressure continuously throughout a full day and night, revealing whether your pressure dips properly during sleep and how severe your morning surge actually is. That information allows your doctor to make a genuinely personalized decision about your medication timing rather than defaulting to the standard convention. If you do switch to bedtime dosing, take your medication about 30 minutes before lying down to allow proper initial absorption. And keep the timing consistent because regularity matters as much as the timing itself. Here is what I want you to take away from everything we have covered today. The prescription itself is one decision. How you live around that prescription every single day is a series of decisions that the prescription alone cannot make for you. The timing of your coffee, the juice you pour with breakfast, the hour you take your water pill, what you do when you forget a dose, and the time of day your medication is actually working at its peak. All of these things shape how protected your heart and blood vessels actually are. You have been responsible enough to take your medication. You deserve to know how to take it in the way that gives you the most benefit. Share this video with someone you know who is managing blood pressure, because this is the kind of information that tends to stay locked inside medical journals and clinic notes. And leave a comment below telling me which of these 5 mistakes was the most surprising to you. Your answer might be exactly what someone else needed to hear today.